Small eyes, big challenge. Yes, this case challenged both the diagnosis and management, pushing the boundaries of what we know about ocular inflammation in the youngest of patients. Good evening, everyone. I am Dr. HIRANI, and let's get on with the presentation. Understanding a bit about occlusive retinopathy or retinitis, it is due to the obstruction of retinal vessels leading to ischemia and vision loss, and can be due to neonatal factors, systemic diseases, or idiopathic causes or infections. The clinical picture that it presents with are retinal hemorrhages, vascular sheathing, cotton wool spots, and neovascularization. So our patient, 11-day-old preterm neonate born at 34 weeks, came to us for a routine ROP screening. He had a turbulent perinatal course: anemia, asphyxia, thrombocytopenia, sepsis, respiratory distress syndrome, which required an NICU admission, oxygen supplementation, and transfusion support. At the initial ROP screening, fundus examination revealed an immature retina with the retinal vasculature extended till zone 1. A rather regular ROP visit, but neonates have their own ways of surprising us. Sorry. Yeah. But at the 2 weeks of age, the rapid antigen test and anti-SARS-CoV-2 IgG came positive for both mother and baby, and the clinical course took a dramatic turn. By 18 days of life, the retina told a different story with vascular occlusions, perivascular sheathing, and retinal hemorrhages in both the eyes. So this was no ordinary ROP progression. With all the infective workup coming out negative, a systemic inflammatory workup was done, and it revealed sky-high markers like D-dimer, LDH, CRP, and serum ferritin going through the roof. FFA was done in the NICU setting, and it confirmed our worst fears with extensive CNP areas, vessel staining, leakage, and features of bilateral occlusive retinal vasculitis. Hence, a working diagnosis of bilateral occlusive retinal vasculitis secondary to SARS-CoV virus was made. Given the severity of retinal ischemia and inflammatory burden, we initiated IV methylprednisolone at a dose of 1 mg per kg per day, 12 hourly for 7 days, in addition to oral aspirin at 25 mg per day. Intravitreal bevacizumab was also given to deal with the retinal ischemia at 1/3 dose of the adult. At the follow-up examinations, we saw resolving vasculitis, vascular reperfusion, and no vessel leakage was seen at repeated FFA at 7 weeks. Despite the recovery, there was persistent avascular retina, for which 532 nanometer laser photocoagulation was done. At the last follow-up, the child had normal age-appropriate vision and no systemic sequelae. So the key takeaways from this case are: this is the first case of post-COVID retinopathy, and ours is the youngest child at the age of 10 days. And the clinical implication is the neonatal hyperinflammatory states can mask as severe ROP, and early suspicion is key. Steroids for inflammation, anti-VEGF for ischemia, and timely laser for avascular retina. This multimodal approach can lead to a sight-saving outcome. Thank you.
And can we have the speaker ready for the next talk here? Any questions, sir?
Can we again go to the fundus photograph where you show that area of vascular leakage that corresponds with the area of vasculitis, because there's a lot of reflection there. Next. सर आपको दिख रहा है ना वो टॉर्च जली जा रही है. So the clinical area of the photograph where you show, okay. So that is one spot you said, no, vascular leakage.
Yes. This was the clinical image.
This is the arrows you have labeled it as vasculitis.
Yeah, perivascular sheathing is seen in the upper
No, that is a hemorrhage around the vessel.
Hemorrhage है इसके vasculitis.
So what do you call it, vasculitis? Actually, there's actually double.
Exudation, other areas you can see the exudations presence.
So we believe his finding is a mixture of one. So COVID did present a lot of vasculitis. So it's something new for everybody.
ठीक है, thank you, HIRANI, Raj HIRANI.